Thanks very much, Chair, and it's my great honour to introduce this session this morning on health. As the Chairperson has said, the context is our policy on fairness, equality and social justice, and health policy has always been a crucial issue for us as a party. Going back through the decades, we've had leading ministers, Labour ministers in this area, Brendan Howlin, now Minister for Public Expenditure and Reform, an important policy leader in the 1990s, talking about primary care, by the way, before anybody ever spoke about primary care, Brendan Howlin was. Before him, Brendan Corish. And right back, the Labour Party has always regarded health and health policy as being critical to what we want to achieve in our country. But I just want to spend a couple of minutes, if I may, this morning just to dwell on the changes that have come about and the kind of challenges that we now have in health and in health policy. And I think it is an issue for the party, and it is a big political issue. In common with health systems all over the world, we have to address, and we are now starting to address at last, really new serious challenges, such as ageing populations, which is a good thing, of course, but we have to address that and how we configure our health services. And most importantly of all, the creeping epidemic of chronic illness. Literally an illness and a challenge that could bring the health service down if we don't address it and address it properly. 21st century diseases and illnesses like diabetes are completely changing and altering the kind of health service that we need for the future. The model of a hospital-centred healthcare simply won't work in the future. The politics of healthcare will therefore change, I think. So all of the debates that we've had in rooms like this over the years about health, how often have they been dominated by debates and arguments and rows about hospitals and closure of hospitals? And that's the case right across the board politically. It's not about that anymore. It's about how we configure the services and how we actually transform the services and how we think about a health system as one that can actually address the kind of challenges for the future that I've spoken about. If we think that the health system now is in a critical state, colleagues, with all of the cuts that have been necessary as a consequence of the economic and fiscal crisis, it will be many, many times worse in the future, conceivably even in the relatively near future, if we do not radically alter the way we organise healthcare in Ireland. If we fail now to plan really fundamental change in the organisation of healthcare, our system, I think, will collapse. It will collapse because of the sheer pressure of demand associated with the consequences of unchecked chronic illnesses, and it will collapse literally because it won't be possible to finance it if we continue with the current model. Healthcare, comrades, has to become the concern of the whole society, not just the concern of those who are ill and those who care for them, but the concern of all of the population. Health has to be literally about health and not about illness. Health has to be about staying healthy and not becoming sick. Health policy has to be about nutrition, fitness and exercise, addressing lifestyle factors such as smoking, excessive consumption of alcohol, what we eat, how we live our lives, taking control of our own health, managing our own health. So policy has to go beyond, and these are the kinds of things that people say all the time, and the debate constantly is about primary care, of course, but the policy has to be redirected. We have to go beyond, as I've said, the funding of expensive hospitals, important and all as that is. We have to give priority to primary care. It isn't just desirable, it is absolutely essential. Care in the community, care and treatment by your GP, your practice nurse, the nutritionist. So it is a political question, and what are we doing about that? We are implementing the policy of universal access to primary care. The budget announcement, the recent budget announcement, and now bringing forward in the form of legislation to extend free GP care, free GP access to children 5 and under is a hugely significant move, but it's just the beginning. Yes, we can see it as a real break, as has been said, for young families, but it's not some kind of sop in the way that has been characterised in some quarters. It is the first step in the implementation of a policy of universal primary care to remove the barrier of fees for attendance at your doctor. It's a public health measure. And I'm proud to have worked with Eamon Gilmore and Brendan Howlin to have it delivered on this critical achievement. Another public health measure is the alcohol strategy. The first time ever we will have a public health focus on our alcohol policy in this country. Ladies and gentlemen, we're political people in this room. We have a shared vision for a better country, for equality, for social justice. Transforming the way we manage and configure our health services is central to the achievement of that vision, so that people can have healthy and fulfilling lives. all of our people, not just those who can afford it. And Labour in government is making real progress on this objective. Just like Eamon Gilmore said last night, our job is to deliver. We debate the issues here, but our job is to deliver in government, to deliver universal access to essential primary care services, to deliver real public health initiatives such as the alcohol bill, to deliver long-standing policy objectives such as the X-Case legislation. We do that in government. That is where we make the changes we want to see. Thank you very much.